And certainly the zero COVID policy in China didn't work. And now they've lifted that policy, and they have a large under-vaccinated population with a virus that is more contagious than it was previously. And the ultimate impact it has on the healthcare system in China is going to depend a little bit on how virulent that virus is and how many people end up in the hospital. And I don't think we'll know for a while. And of course, there's an issue of how accurate the reporting will be. So, relative to the healthcare system and the pandemic, the healthcare system is multifaceted. I'm really reminded of the story where you have a group of people who are blindfolded and they're feeling different parts of the elephant. And if you look at the healthcare system, it has so many different components. Some were able to achieve significant profitability during the pandemic, largely on the payer side. Others were hurt. It also stimulated innovation in virtual and ambulatory care. So there's a lot of change at hand. I suppose my perspective, even though we run a diverse healthcare system with both ambulatory and inpatient, is how the pandemic has impacted inpatient care. And if you think back to 2020, the real problem was access, because in many hospitals, 30 to 50% of the beds were filled with patients who had COVID. And so access was quite limited. And what has happened is that the impact that workload had on the workforce has caused a great fleeing of workforce from healthcare. About 20%, the estimates run. So now we have a problem of healthcare access related to the shortage of nurses, a high turnover rate, an aging workforce, and a lack of growth in nursing schools. And this is going to be projected to grow in the next many years. They estimate probably 1 million nurses short in the United States by 2030. And since hospital care is one of the most intimate human-to-human interactions you can have, I think we all have to be concerned about access.